SCD, sequential compression device. Sequential compression device. This device is used, specifically the one we have right here, for the lower extremity calf, to help move the blood in the veins. Vascular flow. It will compress, pushing the blood out. It will decompress, allowing the blood to flow back in. The item that goes around the leg, we refer to as a sleeve. Now, there's always two sleeves when we deliver it in our bag. Sequential compression sleeves. We have two sizes, regular and large. You look up top, you'll see what it is. This is a regular. Also referred to as bilateral compression sleeves. It's important that you understand there's a pair in here, because often when you deliver this and you hand it to a nurse, she'll say, "I'll need two of these." Well, there's two in here. She'll look at it and say, "This is so thin, are you sure?" Yes, two. They always come in a pair. As you see, they have to come in a pair because what we have here is the machine, the tubing, two ends of the tubing for two of the sleeves. Now the tubing is very simple to connect. You have the large end. You see the odd shape to it. It's not a perfect rectangle. Can you see that? Is that zoomed in on that? Oddball. Right here is like a point. Okay, so you can't go wrong as far as hooking this up. Very simple. As far as hooking and connecting the ends of the tube, again, this is actually flat and rounded corners. Okay, so really you can't go wrong there either. Not to mention, you have an arrow. So you can't go wrong as far as matching it up. You got to match the arrows up. They snap in like that. So we have bilateral sleeves that go with a compression device. Very simply, what you want to do is turn on the device. The device does all the work on its own. There's no adjustment, there's no knob to compress it more, compress it less. The key behind this is how well the sleeve is installed. So let's go back to the sleeve for a second. If you're at a home and they're not sure how to put it on, or even a nurse might not be familiar because she hasn't worked with one in over a year, very simply, you see in here it says ankle. First of all, you know this end goes towards the bottom of the leg, towards the ankle. Comes around. The Velcro is adjustable with different lengths. The key is once it's on there, it should be a little snug, but you should be able to put 2 fingers in there comfortably on both ends. If I can get 4 fingers in there, it's a little too loose. 2 fingers is sufficient on both ends, and it's good. Once you do that with both sleeves, then you're ready to connect it and put the machine to run. This machine, you can see these numbers here. There's a 4 and a 5. You see a decimal point to the left and a decimal point to the right. What those decimal points are telling you is it's running through a series of tests. Basically, it's going to cycle through about 5 times. It's going to fill these boots, sleeves, sometimes referred to as boots, compression boots, you might hear that, and compress, and then it's going to decompress. As it does that, it's sensing whether it's sufficiently snug on the patient. It'll do this 5 times, and it's always taking a reading to see if it's in the right parameters to do the job. Once it's done, this takes about 4 to 5 minutes. Once it's done that, and it's satisfied that it's in the right parameters, which 45 is the right compression it's looking for, the average, the 2 decimals will go away. At that point, decimals go away, the 45 stays, it's going to continue running, and it's satisfied that it's going to be able to compress and decompress properly to do the job. For some reason, the boot is too loose. After it goes through its cycle, right now it's inflating again, it's starting the cycle, starting to fill the boots up. then stops, it starts to decompress. If for some reason the boot is too loose after it goes through the cycles, you'll get an error reading of LO, low pressure, and it'll stop working. At that point, it needs to be refitted a little bit more snug. If the word high comes up, it'll stop working. And basically, it's too tight, it needs to be loosened a little bit. So too much pressure, too little pressure, it will let you know. And that's really all you have to explain to someone as far as how this boot works. The only other thing you want to explain to them is this last button sitting here. So there's really no buttons for them to work with. They turn it on, they put the boot on properly, and if they want some comfort inside the boot, because this could get warm inside, there's this here button called Comfort Cooling. And if you listen, you'll hear a hissing. There are little holes. Air is passing through it to create comfort. That only happens when this light is on. So they can use that at their will. Explain to them, look, the machine is doing whatever it's doing, needs to do, it's working, it's going to work fine. Only thing you need to think about is if it gets a little warm, you can go ahead and hit that button. It'll pass air through the leg for you. If you would like it off, just hit it again and it'll go off. So it's a very simple device to use. Easy really to explain for vascular flow. The connecting tubings connect. There's no wrong way. You cannot connect it wrong. It's impossible. It only connects one way. One switch. Let it cycle through. The decimals will go away. It'll say 45, and they can use Comfort Cooling.